Deaths from overdoses are up 31% in Alabama, and local first responders are feeling the impact. Our Kelly Kennedy explains why overdose deaths may be on the rise and how emergency response teams are dealing with it.
Since the start of the pandemic, more people are dying from drug overdoses. We're seeing this across the nation, and Alabama is seeing some of the highest overdose death rates in the country.
Our call volume is definitely up compared to last year.
Over 200 more people in Alabama died from overdose last year compared to 2019, and local numbers show this trend is continuing. Last year, HIMSI responded to 763 overdose calls. That's about 2 a day. So far this year, they've responded to 376 overdose calls, averaging about 2.5 a day.
What we have seen is a 25% increase in overdoses.
A new report shows opioids account for nearly 70% of overdose deaths in the U.S.
A lot of these have been opioid type increase, fentanyl type situations.
And with more people than ever experiencing isolation, financial problems, and less access to addiction support, the pandemic could be partly to blame.
We're just now to the point of people getting back to somewhat of what we call a normalcy, getting out, going to the ball games, going to the picnics, and various different outdoor activities. So it'll be interesting to see what our May and June numbers look like.
The pandemic created its own set of challenges for HIMSI, and with an overall increase in calls, it's taking a toll on first responders.
We're busier and we're working our employees. You know, we have a shortage of employees.
HIMSI is encouraging people struggling with addiction to reach out for help. For resources in the Tennessee Valley, go to rocketcitynow.com. Putting the Valley first, Kelly Kennedy, WZDX News.